We have 4 NSAIDs this week. The 4 NSAIDs are diclofenac, ibuprofen, meloxicam, and naproxen. There are a couple different ways to remember them. You can remember them because they spell M-I-N-D, which is mind. So you can think NSAIDs, mind. I don't really know if there's a connection between NSAIDs and the word mind, but if you can just remember the word mind with that, then you'll be able to remember it. You can also order them D-I-M-N, which kind of looks like diminish, because they diminish pain and inflammation. Whichever way you choose, it's D-I-M-N or M-I-N-D, whichever one. And those are diclofenac, ibuprofen, meloxicam, and naproxen. Now, the use and expected outcome of these NSAIDs is that they decrease pain by decreasing inflammation. So really important to remember, NSAIDs, NSAIDs stands for non-steroid anti-inflammatory drugs. So you know that they're anti-inflammatory, and therefore by reducing the inflammation, they decrease your pain. That's why diminish can work, to remember them. The action is that they inhibit prostaglandin synthesis. So I really don't know how to remember that besides just memorizing inhibit prostaglandin synthesis, but that's the action. For the NSAIDs this week, we've got 4 side effects that we need to remember. So the first one is all related to GI stuff. It's GI distress, ulcers, or a GI or heart bleed. The second one is hypertension from fluid accumulation. The third one is AKI, which is kidney, it's like acute kidney infection, which can lead to chronic renal damage. So if you have the side effect of acute kidney infection and you continue to take your NSAIDs over and over again, that will lead to chronic renal damage. And then also in a client that has asthma, it can cause wheezing. So again, to go over those, we've got GI related stuff, we've got hypertension, we've got kidneys, and we've got asthma. If you can remember GI, hypertension, kidneys, and asthma, you can remember those. So just again, number 1, GI distress, ulcers, or GI or heart bleed. Number 2, hypertension from fluid accumulation. Number 3, AKI, which can lead to chronic renal damage. And number 4, wheezing in a client with asthma. The other thing we need to know is that there are 3 items of nursing care. So number 1, we're not going to use in patients that have 4 things: kidney disease, which we already talked about the side effect of having kidney infections, cardiac disease. We don't want to use it for people that have heart issues because one of the side effects is heart bleeding, stroke, because we already have hypertension from fluid accumulation. We don't want to we don't want to end up with a stroke because of an embolism or anything. And then asthma, which obviously one of those things is wheezing in a client with asthma. So if you can remember the 4 side effects, then you can remember the first, what we don't give it to, part of nursing care. And that would be patients with kidney disease, cardiac disease, stroke, or asthma. And the reason we don't give it to asthma is, again, because it can cause wheezing and bronchospasm. Obviously, if you have asthma, you do not want to cause bronchospasm because your bronchos are already spasming. Number 2 is know the person's kidney function, because obviously we don't want to give it to someone with kidney disease. We don't want to give it to someone who has kidney functioning issues. So we want to know their kidney function, and we don't want to give it in combination with any other nephrotoxic medications, or with acetaminophen, again, because that can mess with your kidney. So it's just really important to know that you need to know the person's kidney function, and you don't give it with other kidney toxic drugs, because combining that together will increase the likelihood of kidney issues, especially in someone that already has kidney issues. And then you don't want to give it with acetaminophen. Number 3, educate your patients, because if they're taking an NSAID, they probably can buy, a lot of them can be bought over the counter. So that patient may not realize the different interactions that the NSAIDs can have with other NSAIDs or with other things. So you want to educate the patients to ask the pharmacist or the provider regarding the use of over-the-counter medications, because those OTC meds may have interactions with the medication that they're on, especially if those medications are other NSAIDs. You do not ever want to take 2 NSAIDs NSAIDs together. And so that's everything for the NSAID drugs for this week. Just to review, we've got diclofenac, ibuprofen, meloxicam, and naproxen. The use or expected outcome is that they decrease pain by decreased inflammation. The action is that they inhibit prostaglandin synthesis. There are 4 side effects. Number 1, GI distress, ulcer, or GI or heart bleed. Number 2, hypertension from fluid accumulation. Number 3, AKI, which can lead to chronic renal damage. Number 4, wheezing in a client with asthma. And we have 3 points for nursing care. Number 1, do not use in patients with kidney disease, cardiac disease, stroke, or asthma because it can cause wheezing and bronchospasm. Number 2, no kidney function before you give it to a patient, and do not give with other nephrotoxic medications or with acetaminophen. Number 3, educate patients to ask the pharmacist or the provider regarding the use of OTC medications, especially if those are NSAIDs. And that's our NSAIDs for this week.